So Christian Wagner, NTV. While many families are getting assistance from unemployment, what about families who are still working, but getting significantly less money/hours? They don't qualify for benefits, but are not able to make ends meet only working once or twice a week. Is there any help or plans for helping them? So a couple things. First of all, what I would say is those folks should work with their employers about getting a short-term compensation plan put in place at that place of employment. So what the short-term compensation plan does is it allows employers to only have people work maybe between 10 and 60% of what they were going to work otherwise. So you could maybe be working, for example, half-time, and then you could be collecting unemployment benefits the other half-time. But the employers have to enroll in that program, short-time compensation program, contact the Department of Labor. That's how that would work. So that would be one alternative. And then, of course, we've got community collaboratives that are all across the state to be able to help families who are having troubles make ends meet. So that's another area to connect with your local community collaborative. Mona Weatherly from the Custer County Chief. The governor has asked Nebraskans to follow guidelines for Memorial Day celebrations and events, limiting gatherings to 10 people, social distancing, etc. Good job, Mona. I'm glad you picked up on that. What recommendations or suggestions are there for Legion posts and auxiliary units that host Memorial Day ceremonies? So our Department of Veterans Affairs is going to be making an announcement with regard to a virtual Memorial Day celebration, and I encourage then all those Legion posts to participate in that virtually with regard to what we're going to do. So I'd say stay tuned. We will make an announcement on that next week with regard to that, but again, do our virtual Memorial Day celebration. What are the governor's thoughts on town celebrations, parades, alumni gatherings, and county fairs? Many communities may already be in the planning stages or need to be in the planning stages. What recommendations or suggestions are there for these communities at this time? So, reminder, through May, we're going to be the 10-person rule. We're doing that and following along what's going to happen with regard to our healthcare system. If our healthcare system stays stable, then we will be looking at taking other steps to loosen up those restrictions. So you can imagine that a 10-person rule may go up to something higher. However, depending on how many people you think you're going to have and the timing of your event, you can certainly count on some sort of restrictions that are going to be in place when you have your event. So we're looking at, again, parades. For example, if you have a parade where everybody stays in their cars and everybody watches from their homes and doesn't, there's no social interaction there, you could probably structure something like that pretty easily. With regard to, I know people are going to want some guidance on county fairs and so forth. I would say alumni gatherings probably shouldn't be trying to be held unless you've got a very small graduating class. And especially if you've got older alumni, do not invite them. Again, if you're somebody who's older with those underlying healthcare conditions, you need to continue to stay away from those big groups. So especially with the older class reunions, do not have those class reunions. Town celebrations, same deal. You're probably not going to be able to have those the way you've had those in the past, so think about ways to do those virtually. I know that, for example, for high school graduations, folks are looking for ways to recognize by leaving the lights on at football fields and so forth. So that might be some alternatives. But again, you can expect that as we're going into June, we're still going to be under some pretty small restrictions as far as size of crowds gathering. So a lot of those activities really just won't be possible. So we'll obviously put out guidance on that, but we're going to, want to see what happens as we go through May to be able to make those decisions. So we're not going to have anything specifically with regard to June until we get well into May. Chris Stoom, NTV. It's been a while since you announced dorms would be open for COVID at UNK. Are they ready to take in patients? Yes. Yep. Hey, we're working on that. So absolutely. So yes. They're actually in place and ready to go. We do not have anybody staying in the dorms there currently, but yes, they are ready to go. Daniel Berman, Enterprise Media Group. Is there any indication about what restrictions that DHM would have in place and why a new DHM would be issued for a district to include Washington County? Washington County has few cases. So again, I think we just made that announcement with regard to the Three Rivers Public Health Department. That includes Washington County. They will be going under the less restrictive guidelines starting May 11th. Rob McCartney. Some federal stimulus dollars are now getting to area universities and colleges. The University of Nebraska has already announced free tuition for students from families making less than $60,000 a year. What else should the state do to help higher education students? And again, I would certainly be working with the University of Nebraska with regard to those things. I think that one of the things that we can do at the state is continue to follow our plan with regard to slowing the spread of virus here in Nebraska, focusing on making sure we preserve our healthcare system. I think that's the best thing we can do for those students. DeLon Dillard, KETV. We're hearing from doctors that Nebraska is still a few weeks away from peak cases. Doctors also warn of a potential second wave of cases. Do you think it is responsible to ease restrictions when we are still expecting vast number of more cases to come? When do you expect Nebraska to hit its peak? So let's take a step back again, folks. A couple months ago, when we were all talking about what to do with regard to this pandemic, all of our public health experts said you cannot change the area under the curve. That means you cannot change the number of people getting infected. All you can do, we don't have a curve here, but is you can flatten the curve, which means you spread it out. Same number of people are going to get infected because it's a virus. We can't stop it from coming. But you reduce the peak so that you don't overwhelm the healthcare system, that you make sure that everybody who needs that hospital bed, that ventilator, can get access to it. That's what we were all told to plan around a couple of months ago. And that's what we've done. We've put restrictions in place that have accomplished that. We've been very successful here in Nebraska with regard to flattening that curve. We have not even come close to overwhelming our healthcare system. In the places where we have hotspots, places like Grand Island, we have worked with the local healthcare providers like CHI St. Francis to be able to move patients to where we do have capacity to make sure that we can continue to serve people. And we've been very successful in that. In fact, my recollection is, Dr. Antone, that right now CHI St. Francis only has 10 patients on ventilators, which is down from where they were for the past couple of weeks. And I'm sorry, 10 patients in the ICU and 7 on ventilators is my recollection. 6 now on ventilators. So again, the numbers even there are declining. So even in our place where we have the most cases, we have seen that we've been able to manage the healthcare system. And if you look in places like Omaha, where we've got, I think we've got, I should have remembered those numbers better, but it was like 346 ventilators, 106 were in use, 20 or so. You get the numbers there, Dr. Antone? Are you looking at the numbers? Am I trying to make this up and you got the numbers?
No, I mean, you have such a good memory. I can't believe you don't.
So, do you have
there are 76% of the ventilators in Omaha available.
76% of the ventilators in Omaha are available right now. So, and that's our largest metropolitan area. So if you look at our largest metropolitan area and you look at what we've got with regard to Grand Island, where we've got the most number of cases, the healthcare system is well in hand. And so that's why we have the confidence to be able to start loosening some of these restrictions. Again, it gets back to that analogy I used. We could end all fatalities, or almost all of them, on the interstate if we took the speed limit down to 5 miles an hour. But we don't do that. We have, in a sense, done that with everything we've done with these restrictions for regard to coronavirus. We've really slowed things down with the restrictions we put in place, and it's worked. We've pushed that curve down, we spread it out, we have not overwhelmed the healthcare system, and now what we're trying to do is loosen these restrictions gradually over time to figure out, well, what is that right speed limit? Where can we take this up to? Where do we have that capacity? And so that's what we're doing right now as we start to loosen these restrictions. So again, the thing we were told to manage to 2 months ago, we have managed to it, and we've managed to it very successfully. And that's what we're going to continue to do. So with that, Taylor, do you have other questions that came in?
Kevin from WOWT wanted to know if there was an explanation for the sharp drop of new positive cases yesterday.
So Kevin, WWTV wants to know if there's an explanation for the sharp drop in new cases yesterday. And yes, Kevin, there was a data error in that. So the data out there is not accurate. So anybody looking at the data from yesterday, that data is not accurate. What happened was we sent a bunch of records from the public health lab. It kind of bogged down the system. We've taken steps to make sure that doesn't happen again. But because the system got bogged down, not all the cases got reported. So what our plan is, by 5 o'clock tonight, or 5:45 rather, between 5:45 and 6, we should have new updated information that should accurately reflect what happened yesterday plus today. So we should get back on track by about 6 o'clock tonight.
He also asked, when will Test Nebraska reach its 3,000 tests a day goal?
And so the question he also asked is, when will we reach the 3,000 tests per day goal? Again, when I announced this, we said it would take us about 5 weeks to be able to get that up and running. So get to our maximum, I should say. So we're working on getting the lab set up right now. We're still planning to be able to start rolling out testing in Omaha and Grand Island. So again, for folks in those communities, sign up at testnebraska.com. Great opportunity to be able to go out and do that. So get signed up so that you can start getting in line for the testing. Grand Island, Omaha will be first when we start getting it rolling, but it is going to take several weeks to get all the teams signed up to be able to get to that maximum of 3,000.
Julie Cornell from KTB says Nebraska medicine has seen a spike in cases. Do you think that has anything to do with people not following social distancing at Easter, which was about 2 weeks ago?
Julie Cornell says UNMC has seen a spike. UNMC has seen a spike in cases. Is that related to people not following social distancing at Easter a couple of weeks ago? I certainly can't give you any scientific evidence, and nobody from UNMC or anybody else in our public health divisions has said specifically that Easter celebrations were responsible for any sort of uptick in the number of coronavirus cases. We've had some anecdotal evidence and so forth, and we do know that we can trace specific outbreaks to, for example, somebody who was in one city and went to Grand Island and came back and did infect other people. We know also there was a party that was going on, that the person was showing symptoms and she ended up having the party anyway, and so other people got infected. So this is again why when we're talking about Cinco de Mayo or Memorial Day celebrations, please, if you limit to your household, that's going to be the best thing to do. That's going to be the safest thing to do. No more than 10 people at the most. And if you are symptomatic, do not have a party, do not go anywhere, right? If you got that fever, that cough, that shortness of breath, anything that, go on the CDC website, you can see what their guidelines are, but do not go out, stay home and quarantine yourself so that you do not infect other people. That is so important that when you start showing those symptoms, you absolutely stay home.
Aaron Duffy from the World Herald wants to know if you've asked meat processors to institute any particular measures on your calls with them. Have you talked to meat packer workers directly?
So Aaron Duffy is wanting to know if we've asked food processors and meat processors to do anything specifically. Actually, this is why we have UNMC and their Global Health Center, and I want to thank Shelley Sweetholm and her team for this. They put out their meat processing facility COVID-19 playbook. It's out there on their website so everybody can see it, and that has been distributed to other states like Iowa and Missouri. And this is what, and actually, frankly, it's probably goes a little bit beyond what the CDC guidelines that came out, I think yesterday or the day before were. This is what we're showing to all of our food processors here in the state as best practices, and this is the kind of thing that we're asking them to do. So yes, so we are making those specific requests of food processors saying, hey, these are industry's best standards. I've talked, not only do we do that on my weekly call with the food processors where we go over this, the playbook and talk about those things. Shelley goes out and visits facilities. I think she's doing site visits today. She's also, so I think that'll bring it up to maybe 9 facilities she's been to, 9 or 11. She's been out visiting facilities. I've had personal conversations with some of the facilities asking them to, again, make sure that they're following the guidelines and so forth. So we are absolutely doing that. And the second part of the question was if I talked to workers. We get the feedback from workers. I have talked to Eric Reeder, who is the UFCW president, local 293. And so he's given me some feedback on what he sees as best practices and what he'd like to see the food processors doing. And we also get that feedback back through our local public health departments and the kind of feedback they're hearing from workers directly or from the health clinics and so forth.
Liliana from WWT says the state wants to get through 75% of unemployment claims in 21 to 28 days. Are we meeting that goal?
So the question was from Liliana, the state's goal is to get through our 75% of our unemployment applications between 21 and 28 days, and we do not have Commissioner Albin here, so I cannot tell you how close we are to meeting that goal. I can tell you on Monday we processed about $40 million worth of the pandemic unemployment assistance program. And I want to just again put this all in perspective. Since beginning of March, so in roughly 2 months, we have received as many applications as we had in the previous 2 years combined. So over the last 2 months, we've received as many applications into the Department of Labor as the previous 2 years. That just gives you an idea of the type of volume that we are receiving in. So we are working to be able to process those applications. We've hired outside firms to be able to help us with that. Some of the feedback we got back from the outside firms when they started doing this work for us as adjudicators, they said, oh, this is more complicated than we thought. So we've gone from about 34 people processing these applications as adjudicators up to 166 people processing these as adjudicators. So again, we're working to be able to get through these as quickly as possible, and we'll have to get back specifically with regard to where we are with regard to that 75% goal.
Rob McCartney said he had a reader question or viewer question about why doesn't Test Nebraska let you update your information, and why can't you identify additional conditions or comorbidities when you check the box other for other conditions?
So Rob McCartney's question is, why can't you update your profile, and why can't you list other sorts of conditions when you check the other box? With regard to that, again, we were trying to make something that was relatively streamlined and get it up so that people could start doing the assessment and get registered for the testing. We will allow people to go back and adjust that through a process of updating their profile as we get closer to doing the testing and so forth. So that will be coming. So stay tuned on that one. And then with regard to the other box, again, we're just trying to streamline it, make it as efficient as possible so that people didn't have to spend a ton of time on that. But again, if you've got underlying conditions, you'll be able to, certainly be able to inform somebody about that as you're taking the test, or your doctor or something when you get that test result back. But really kind of focus on the things that were going to be the highest priority with regard to that, trying to keep it streamlined so we can make it user-friendly.
He also asked, are we going to eventually test the general population so someone can get a test due to their age or high blood pressure or stuff like that? So
the question was, are we also going to test the general population? So our plans will be, when we start doing testing, we'll certainly focus on the people who protect us, those healthcare workers, first responders, then highly symptomatic people, then less symptomatic people, and then asymptomatic people as we have capacity. So to the point about getting to the asymptomatic people, we will get there, but we're going to prioritize those other folks first.
Bill Shammer would like to know how are employers being advised to handle HIPAA and personal safety. He had a word from a spouse of a meatpacking worker who is sick with COVID after he says his company didn't inform her husband that a worker next to him on the line tested positive days earlier. So
Bill Shammer wants to know how companies are handling HIPAA with regard to with regard to people being sick. A report of a woman who claims that her husband got sick after working next to somebody who was also tested positive and sick, but the company didn't tell the worker supposedly that the person was sick or whatever. Actually, the way that process is supposed to work is through our public health departments and our contact tracing. So that is how, when somebody gets identified as being COVID positive or coronavirus positive, then what we do, working together from the state, we were supplying additional resources to the counties and their public health departments to be able to do that contact tracing. So that's how that process is supposed to work. I can't speak for the specific case, but that's how that would work, is really being, working to be able to identify who was working next to that person, but also in contact in social situations and all those sort of things. That's what the goal of our contact tracing would be. But again, we're relying on the person who was identified with coronavirus to tell our public health departments about that, right? So this is not the company's responsibility necessarily. This is what the person's got to let us know who they've been in contact with.
Don Walton wants to know if you believe meatpacking workers are being adequately protected even if they can't do 6 feet of physical distancing.
So Don Walton wants to know, are workers being adequately protected in our meat processing facilities, even if they can't be, 6 feet apart? Again, what we want people to do is socially distance where possible, that 6 feet. I've given lots of examples where that may not be necessary. Some of our new DHMs are going to allow, for example, for salon workers to work if both the hairstylist and the customer is being masked. And so with regard to our meat processing facilities, I will tell you that our processors are taking a number of steps to be able to do social distancing, and also not only spreading people out, but putting up barriers. So for example, putting up barriers between workstations, putting up plastic barriers at the lunchroom so everybody eats by themselves, taking temperatures of people who are coming in. I know that Shelley Sweethelm has done a number of tours and advised them on additional steps they can take with regard to asking more questions about people being symptomatic, or addressing their air handling conditions, or doing more hand sanitizing stations and so forth. So it's a very difficult environment to be able to socially distance, but all of our meat processors are working diligently to make sure they take care of their folks and do the best they can in a very difficult environment to do that social distancing and put up those barriers. And then the other thing we got to remember too is this also has to happen at home too, and we've talked a lot about that, where a lot of these communities that are working in the meat processing facilities, English is not their first language, so we've got a language barrier we've got to overcome. Sometimes there's distrust for government, so sometimes they're not paying attention to what we're doing in state government or our local public health departments. A lot of their living conditions are much more densely, packed than maybe somebody else's house. So we got more people living in a household. That makes it difficult to socially distance. And then we're working to address each of those issues to be able to do a better job communicating, to reach out to local community leaders, to be able to help be that friendly face that can talk about contact tracing or testing or any of the number of things with regard to working at home to do a better job of social distancing. And then we're also working on helping those families find ways that they can isolate by, moving people into a dorm room or a hotel room or so forth. So we're taking steps to address all those things. So there's a lot we're doing to be able to protect the health and safety of those workers, to be able to mitigate what is a very difficult situation both at work and at home to be able to socially distance.
Will there be testing for the coronavirus this week in South Omaha where there's packing plants?
So the question was, will there be testing this weekend in South Omaha where we have packing plants? Omaha is doing continued testing, so not just around the meat processors, but just in general with regard to the Omaha community. So there will be continued ongoing testing.
Riley Johnson from the Journal-Star would like to know if you consulted with Mayor Gaylor Baird as well as Health Director Lopez about their DHM and what input you incorporated into your new directive.
So I'm sorry, so who was it, Riley?
Riley Johnson.
Riley Johnson from the Journal-Star wants to know if we consulted with Mayor Gaylor Baird and Pat Lopez, the local public health director here in Lincoln, with regard to their DHM, and the answer is yes, we did. And Pat provided us feedback, for example, on things such as the restaurant openings, and some of that was incorporated into the guidelines, or the guidance document was put out. I know that Pat also worked, for example, with Zoe Olson, who we had here yesterday, it was yesterday, right, talking about the restaurant guidelines and so forth. So yes, it was a collaborative process.
And finally, Michael from the Dakota County Star would like to know if summer sports teams like baseball and softball will have the opportunity to play this summer. He says it seems like these sports are socially distanced.
Michael from the Dakota County Star wants to know if they will be able to play baseball and softball this summer. And so again, that gets back to what I was talking about before, some of these other activities. So it was certainly not in May, okay, because we got the 10-person rule, and that it's going to be difficult for anybody to play a game in baseball or softball with only 10 people, though as kids, you can kind of do that stuff. But not right now, so not this month. As we get into June and we look at loosening some of these restrictions, I could envision we maybe get to a point where you can maybe do practices, but that's not a promise, that's a speculation, and it depends on what happens in May here with regard to us loosening up our guidelines. So if our health system stays stable, we will be loosening up guidelines further, and we may be able to get to the point that people may be able to do some practicing in June. And could you see that maybe ending up in being games this latter half of July? That's potential, but I would say that if you're thinking about pulling your team together and you're going to do practices in May, that's not going to happen. And maybe you'll be able to do it in June, but certainly I would not count on having any games played in June. Maybe, but don't count on it. Is that it, Taylor?
That's all I got from you.
Okay, great. Fred.
DHMs identical with the DHMs for the other counties that have been relaxed?
Thank you very much, Fred. I appreciate that question because I forgot to mention that detail. Yes, the new DHMs for the 3 public health districts I just mentioned will be on lines with what Douglas, Sarpy, and Cass County have. So same sort of relaxation of the restrictions on restaurants having dine-in capacity up to 50% of the rated occupancy, salons being able to open but with masks for customers and stylists and so forth. Paul.
Two main questions. This is the 20th of your 21st day, let's stay at home. How would you rate Nebraska's compliance with that?
Well, I would say generally Nebraska's doing a great job. I would say that actually based upon that, we got traffic data back from that I was going to talk about today too, and I forgot to. The traffic data actually for last week is not as good. So we've been doing a really good job for the first few weeks of that. Last week, the traffic data was only a 23% decrease from our baseline versus the 28% we were the week before. Omaha and Lincoln were at minus 27% from the baseline versus minus 32 and 35%. So we've actually kind of dropped off a little bit. So come on, Nebraskans, we need to kind of step it up here. Continue to stay home. Maybe people are anticipating the end of the month coming along or something like that. But in general, if you look at what's happened with regard to our social distancing and things like that, it has resulted in the goal that we wanted, which is to preserve the healthcare system. So we're still at, big capacities with regard to hospital beds and ventilators and so forth.
Yeah, are you concerned with better weather that people are going to say, hey, it's time to get out?
So the question is, with better weather, are people going to say, hey, it's time to get out? And look, folks, I think everybody's tired of doing this, but we got to continue to social distancing. We're going to be doing this all through the summer and fall in some form or other. So as you decide to get out and enjoy the nice weather, which we want people to do, please remember the social distancing guidelines, the 10-person rule on gatherings, best if you're only within your own household, and then certainly as you're out, stay 6 feet away from other people. So again, we want people to continue to practice these good social guidelines, and we're going to be at that 10-person rule through the month of May.
And a couple questions about Test Nebraska. You said now the state is up to 1,000 to 1,200 tests a day.
Right.
How is that possible? What's happened? I think we're at 600 to 800 a week ago.
So the question was, we were about 600 to 800 a week ago. I think it was probably just a little bit longer ago than that, but not long ago. And now we're up to 1,000 to 1,200 tests a day. How is that possible? Well, first of all, the folks at the Public Health Lab are really busting their tails to be able to turn around tests and get them out. So I want to compliment the team. We talked about kind of some of the limitations on reagents and so forth, and just the machines and how much time they can do. They have done a fantastic job of stretching that and making it work. So we said that with some of the pooling, we might be able to get to 400 tests a day, and they've been able to do that. They've delivered on that. So the folks at the Public Health Lab have really done a great job, and I want to thank Pete Iwin and all the folks there. They've done fantastic. Also, what we're seeing is, as the commercial labs have been able to step up, we've been able to get more tests back from the commercial labs like LabCorp and Quest. We've also seen hospital systems around the state develop their own tests and be able to ramp that up. So for example, CHI has been able to do that. Of course, UNMC is a partner with their machines to be able to do more testing. So I think what you're seeing is just a collaboration of everybody finding ways to continue to improve upon what they're doing to be able to process more of these tests. And we're going to continue to focus on that as well. As I mentioned, we received the list from the federal government of all the machines that could possibly do this type of testing, and we're reaching out to them to be able to find out what are the obstacles for them doing that. Now, these are not, by and large, they're not high throughput machines, but if we can get reagents for them and work with those facilities, we can expand testing that way as well. So we're continuing to look for ways we can expand testing. The Test Nebraska is one of those ways, but we're not leaving it at just that. We're looking for other ways too. And again, like I said, the team at Public Health Lab has really done a fantastic job.
And it's been just over a week since you urged people to sign up. Looks like we only got 4,000 new ones from yesterday. Are you encouraged or discouraged by the sign-up rate?
Look, I think 104,000 people is a great start, but folks, we're still behind Iowa. We got to catch up here. So do that hashtag Test Nebraska Challenge. Go sign up. Get it out to 5 of your friends. Use the viral power of social media to be able to fight this virus so that we can get more people signed up. This is, again, how we are going to look at allocating our testing resources. So if you want testing in your community, get people in your community to sign up for testnebraska.com.
But you haven't mentioned where we rank with Iowa. We're getting our rear end.
Off the top of my head, I don't know how far, where Iowa was, but I know Iowa was like at 80,000 like a couple of days in when they announced, and we were like at 50,000. So I know we had some catching up to do. Yeah, Lee.
The announcement, executive order from President Trump in regards to the meat packing plants and the facilities to stay open. Do you have any comment about the reassurance towards your plan or what that does also for the state of Nebraska?
Well, certainly I appreciate President Trump issuing that executive order, really reinforcing how important this industry is to be able to supplying our food in the country and our state. So it's important, mission critical, that we keep this open, and that's what the president recognized. But we also have to do all the things we're doing, right? So we have to continue to focus in those communities where we have food processors. We've got to work on the testing. So we're doing, for example, in Dakota County right now, we're doing a lot of testing. The National Guard is assisting with that. Then we got to do the contact tracing. This is part of what we're doing with regard to expanding our contact tracing teams. So we expect by the end of next week, we'll have that first group of 325, those first 10 teams all up and trained and assisting our public health departments in doing that contact tracing. We'll have 4 of those teams will be up and running this week to be able to help do that contact tracing and assisting our public health departments, specifically in these areas where we have a lot of cases and in the communities where we've got that food processing. We also have to continue to work with the plants on the things they're doing. We talked about earlier with regard to social distancing, the steps they're doing to be able to put up barriers between workstations, taking temperatures of people coming in, looking at how they can change the layout, their air handling conditions, lunch rooms, all those places, breaking up those places where people can congregate. So we've got to work with our food processing facilities on that. That's what our, the UNMC's Global Health Center has put out with their playbook to be able to help establish those best practices. And then we've got to reach out into the community to get that social distancing at home. So that's what we're all talking about when we're talking about reaching out to health clinics and other local community leaders to help us with the education on social distancing, the contact tracing, the testing, all that sort of thing, doing all that communication in languages that are reaching those communities like Spanish or Somali or whatever it's going to be. Those kind of things, those are all the sorts of things we have to do to be able to address this from a community standpoint, to be able to actually put into practice that executive order of keeping these facilities open. That's what this is all about, is all these things are necessary to be able to do that social distancing to keep these facilities open. And that's what we're working very hard to do.
The strain, though, with workers being taken out of the workplace is put into this, fear of there won't be meat at the stores. And so if you go to some of the grocery stores here in Lincoln specifically, shelves are clear, meat's gone. What is your advice to people in terms of like this panic buying or we need to stock the shelves?
Well, again, so this is similar to what we saw with like toilet paper, right? Go in and buy what you need for the week. A couple months ago, we told everybody, go out, get 2 weeks worth of food. They should still have that, right? So go out, shop once a week, buy what you need for the week. We're going to keep the supply lines open. You may not have all the selection you had in the past, but again, this is why we're working so hard to keep these facilities open. We're working very hard to make sure these food processors stay open so that we can continue to supply the food to those tables in Nebraska and across the country. So shop what you need, shop once a week, don't take the family, just shop what you need for that week, and we'll continue to work on keeping these open so that food supply chain is there.
And then one final one, what's the balance between the livelihood and the emotional strain on some of these workers, but balancing that with also staying open, because this is a hard place for these people to be in. Going into work every day, that fear of, am I going to get sick? Am I going to be able to maintain my job? Is my employer going to release me? That kind of thing. How do you work with the employers to reassure those workers?
Well, we are working with the employers to put all these social distancing steps in place, and frankly, the people who work there also have to worry about social distancing at home. In fact, they're probably more likely to pick up an infection outside the workplace, where they spend 2/3 of their time, than they are inside the workplace with all the changes that are being made. In fact, in talking to some folks, there's looking at cell phone day, there's a potential that maybe where most people are getting it is at the grocery store. So again, that's why we tell people, don't take the family, shop once a week, do it quickly and so forth. So we want to make sure that we're looking at all aspects of life to be able to do that social distancing. Work is one aspect of that, and we're working directly with those food processors on that. But you're exactly right. It is a balance between what we're doing right now with regard to protecting the health of the workers and maintaining the food supply chain. We got to do all of that, and we got to look at it in a global picture here with regard to the entire community and every aspect of what we're doing. And we know, for example, as I mentioned, a lot of the workers come from places where their households are socially difficult because they've got a number of people in multiple generations. We're working to address that through things like our hotels and dorm rooms. We're working to do outreach through different languages, and we're working with the meat processors on their facilities. So it's really got to be, everything's got to come together to be able to make this work.
I think a lot of hair salons and barber shops are structured so that the people are self-employed. And will they lose unemployment benefits if they decline to reopen?
So the question was, if you are self-employed, say in a salon, and you decline to reopen, are you going to lose your benefits? And the answer to that would be no. Because if, again, what we've directed the Department of Labor to do is be very expansive, that if you are one of those self-employed people and you choose not to open up your shop, and it has to be coronavirus related, so it does have to be related back to coronavirus. But if it is related back to coronavirus and you choose not to open up again, you will not lose those benefits if you're self-employed.
Governor, the President's declaration about meatpacking plants, does that raise the priority for workers to get PPE or to utilize the dorms and that sort of thing to self-isolate?
So the question was, does the President's order raise the profile of those folks to get PPE or live in dorms and so forth? Certainly we were already working to be able to make sure that the plants were staying open and providing the dormitories and so forth. We're looking to help those families be able to get, for example, into the dormitories and so forth. And, again, we're encouraging the companies to work with regard to getting their PPE because, again, we're still going to have the priorities that I mentioned before with regard to healthcare workers and so forth. So, yeah, so, I mean, potentially, I suppose it would help, potentially it would be something, but we've still got higher priorities with regard to healthcare workers and people who are directly taking care of coronavirus patients. So we're encouraging the food processors to reach out and get their own protective equipment.
Do you know if any of the workers have taken advantage of the dorm rooms or hotels to isolate?
I know we've got a few people in Omaha that are taking advantage of the dorm rooms right now, but I don't know specifically if they're working at food processing plants.
Have you considered going to one of these food processing plants just to reassure people and see for yourself?
So the question is, have I considered going to one of the food processing plants and seeing it for myself? Again, I'm taking my own advice, what we've been talking about with our Stay Home to Stay Healthy, which is I go between my house and the Capitol and back to my house. So I've not been taking unnecessary trips outside of the household because I've been trying to live up to what I've been telling everybody else. In fact, the only trip I take outside of that is on Saturday, I go pick up pizza to bring back for lunch, and I stay home all weekend long for just that reason. So no, I haven't been to any of these facilities. We have discussed it, but we've decided that on balance, it's better to continue to follow the rules that we're telling everybody else to follow.
Home in Omaha or across the street?
Home in Omaha. Yeah.
Anybody ask if bowling alleys are included in these lifted restrictions? Can they start bowling again?
So the question was, what about bowling alleys? Bowling alleys were never prohibited from being open, right? So they were never closed specifically. They have to follow the same rules as everybody else, though. They got to have 10-person rule, which means no more than 10 customers in their bowling alley at any one time, social distancing 6 feet apart, that kind of thing. So, but bowling alleys can be open with those guidelines.
Governor, just a small correction, you had said there were $40 million worth of PUA paid.
Yeah.
They paid $6 million PUA and 11,000 claims. I think $40 million is overall.
Oh, 40 million was all overall we paid out. Okay, sorry, Money. So I'm sorry, so the PUA was 6 million out of 11,
6.8 million.
6.8 million, and how much?
11,000.
11,000 claims. Thank you, Taylor, for that correction.
We have time for a couple more.
A couple more questions. Yeah. Okay.
Mentioning the priority for PPE, for example, salons say they're unable to get PPE, would you recommend they stay closed because of that fact if they can't get that equipment?
Well, both the customer and the hairstylist will need to be masked. That's in the DHM. It is a misdemeanor to violate that. So if you cannot meet those, then yes, you should not open.
And one more follow-up, is the state helping supply cleaning products to these in-person businesses that are reopening or working?
So the question is, the state supplying cleaning products to businesses are reopening. Again, the hand sanitizer and so forth that we are providing is in the priority I mentioned earlier. So businesses are at the bottom of that list. It's up to the local public health department to make that determination, but when we distribute out that hand sanitizer, its priority is to go to healthcare workers, first responders, that kind of thing first. One more question? Paul.
I did notice the public tours of the Capitol are not closed. Did you have any play in that decision?
Paul says he notices that the public tours of the Capitol are now closed. Did I have any role in that decision? I did not. I was not a part of that decision, so.
Capitol Commission,
Capital Commission, yeah, I think that might have been a call just by Bob Ripley specifically. But I don't even know the answer to that, so don't take that as gospel, because again, I have not talked to Bob, so I don't know that he did do that. All right, folks, again, thank you very much, appreciate it. Again, we will continue to have these briefings, 2 o'clock Central Time, the rest of the week. Tomorrow night, 5 p.m., we'll have the Spanish language briefing on NET tomorrow night, 8:30 to 9:30 on Speaking of Nebraska. Thank you all very much, and thank you to all the Nebraskans who are working to slow the spread of coronavirus here in our state. Please, based on the traffic data I said, we still needed, this past week, we kind of let it slip a little bit, so everybody needs to kind of get back on the ball with regard to staying home, staying healthy, staying connected, following our rules with regard to staying home so that we can slow the spread of coronavirus here in Nebraska. Thanks very much, and we'll see you tomorrow.